The following program contains mature subject matter. Viewer discretion is advised.
Fever. What do you think of when you hear fever? Infection?
Yeah.
Mm-hmm. And usually you're thinking of things like the flu, maybe a pneumonia. But do you think about genital herpes? Well, according to the CDC and something we know as doctors, a low-grade fever can often accompany the first breakout of genital herpes, and you can have some of these what we call nondescript symptoms, where maybe you don't feel great. You can have a low-grade fever.
General malaise.
And your first outbreak of genital herpes may not even be that profound. You know this as a dermatologist, and so people will, and this can happen with any sexually transmitted infection, in fact. But this is a lot of people, we were talking to people that work on our show who are not doctors, and they were shocked to hear that you could have a low-grade fever with a genital herpes outbreak.
Yeah, and so these kinds of symptoms, remember we're talking about the first time you've been exposed to the herpes simplex virus, and this is usually type 2, which affects about 1 in 6 people, so pretty prevalent. Wow. And it's about 2 to 12 days after that sexual exposure. You may feel lousy, you may feel like little swollen lymph nodes, have a low-grade fever, but then it is usually accompanied by a patch of redness with little tiny blisters or vesicles in the groin area. That would be the telltale sign clinically of a genital
And the
herpes
first time,
outbreak.
typically, that it's more painful.
It can be, yeah. And then oftentimes you'll even get the pain and the burning and the itching before you see the actual lesions on your skin.
Headaches may come along with it.
And if you have these symptoms and you're concerned that maybe you do have HSV, there are antiviral treatments that can help decrease the duration of your symptoms and severity. But for most individuals who have it, they don't even know they have it.
Correct, and so that's actually an incredible point, because not everybody who's been exposed to the virus even manifests the lesions. And so the thought is that once you get exposed, it actually goes and remains dormant in the roots of your nerves and then reactivates periodically when, for some reason, your immune system isn't working as well as it typically does. So it's usually when you're sleep deprived, you're stressed out, you're sick from something else, then your immune system kind of backs off from keeping it in check, and it reactivates along one nerve root. So I think what's most distressing about herpes simplex is that you can't really cure it.
It's
there forever, but you can take antiviral medication when you start to feel that burning or those symptoms, and at least that keeps it at bay.
And I would like to add one thing, which is if you are starting a sexual relationship with your partner and you both agree to go get tested, understand that many sexually transmitted infection panels do not include the herpes simplex virus. So a lot of times you actually have to explicitly ask, is that included or not included? Because mistakenly people will say, oh, you know, I know I'm clean, but if you don't actually, if you're getting tested for sexually transmitted diseases, including herpes simplex, you have to see a line item list of everything they tested for, whether it's chlamydia, gonorrhea, HIV, HSV. You have to just make sure, because it's not enough to just say, oh, I've been tested. You don't know unless you've seen the actual panel exactly what you've been tested for. It's getting hot in here.
It was exhausting.
I'm just still bummed out. Because this entire show, I don't know if you all have noticed this, I've stayed to this side of the table because you told me I have coffee breath, and I'm self-conscious. I can't help it.
You know what? We're going to cheer you up, buddy. We're going to get you a sport coat like Dr.
Thank you. Thank you.